everyone. Welcome to Adult Education and Senior University. This is the Empowered Caregiver series exploring care and support services, and it's presented by Linda Curley. So please welcome Linda, and she's going to start talking to you briefly.
My name is Linda Curley. I do work with Purdue University Extension. Those of you that have been on the call with us in the past for this series, just know that this is probably our fifth presentation that we've done in the Empowering Caregiver series. So if you missed any of the series that we had or the sessions that we had before, please reach out to Annie or Amanda, and perhaps they have the video recording that they can lead you to. And we'll connect again with Annie and Amanda to offer more of these programs. While I work with Purdue University Extension, I do partner with the Alzheimer's Association. So all of the content that I'm sharing with you today, it is developed and provided by them. I am just a spokesman for them today and a vehicle for delivery. Okay, so we'll move on with this, and I just want to make this a little smaller as I move forward. Okay, so let's look at exploring care and support services. That is the topic that we're talking about today. As I said, we did all of the other sessions that are not bolded on this slide. And if there are any that you're still interested in that you may have missed previously, be sure to reach out to Annie or Amanda, and they'll let you know where the recorded version of the conversation was. So let's look at some learning objectives today. So we're going to explain why it's important to plan for care and changes. Just know that there are several stages within Alzheimer's and dementia, and as you move through stages with the individual that you love, you may have to change your care plans. All right. So we'll look at different kinds of respite care, and this can include informal care, informal care that you might not even suspected to be important to you. And we categorize it in a way that might be useful for you to understand. We also have day and home care. So let's talk about those together later on. We'll compare different kinds of long-term and residential care. So there are different types of care out there, and we want to make sure that we look at long-term, residential, and even end-of-life care options that you will have. Know what's important when moving a person from one care setting to another. So somebody can move from a home to a care facility. They can move from home to an emergency room. They can move from a care facility to a different type of care facility. And all of these things can be disorienting to an individual, and it's something for you to get used to as well. So we'll give you some tips here as to maybe having some conversations with the staff that'll be at the new building, with family members, as you start to think about the movement to a different place for this individual. And then, as always, we will always look at the Alzheimer's Association's resources that can be helpful to you, even some local resources that I will mention. And I'm hoping too that if you've experienced success with any kind of local resources, that you be sure to share them at the end of our presentation today. Okay, so let's look at preparing for the future as we think about being prepared. So we know that the more you know about the disease and what you might face as a caregiver, the more prepared you will be. So we want you to be able to know and learn about the disease and the progression of the disease, and hopefully some of the sessions that we previously done to help you understand that. We know that the knowledge that we provide you, or the knowledge that you gain perhaps through the Alzheimer's Association, it's best for you to be learning so that you can kind of prepare for your caregiving role. And as you think about the person you're caring for, that you love and care for, perhaps you can work out something that's not so taxing on you all the time, because this is a big role that you carry. So we'll look at those as well. Okay, let's do a little bit of a check your knowledge. I'm going to ask you to put a number in the chat box, okay? On average, what percentage of people living with Alzheimer's or dementia are receiving care at home? Is it 25, 42, or 80%? Okay, well, the person or the persons that checked 80 or gave us the answer 80, you were correct, which, when I first heard this statistic, I thought this is an enormous statistic of folks that are trying to provide care at home. We realize that people are most comfortable in their own home, but it can be overwhelming to keep making these changes. So 80% of people living with Alzheimer's and dementia are receiving care at home, and most care at home is provided by the family, friends, or other unpaid caregivers, which is huge. So many of these caregivers have left their jobs, reduced their hours, changed their hours, taken on a different job because they can work during a different time of the day that's helpful. And so we realize what a difficulty it is for folks. Okay, so this slide talks a little bit about understanding the disease. Alzheimer's progresses slowly into these three general stages. And just know, as I've said before, there is no cure for this disease. And so this progression is going to continue to move forward. We can slow it sometimes with different medications, but it moves from mild, where oftentimes the individual might still have lots of ability to speak with you and, really think about things, but perhaps they're repeating themselves quite a bit, or maybe they're getting a little disoriented with where they are and remembering things and so forth. Then we move through the moderate stage and finally to the severe stage, where oftentimes you are looking for care, more maybe around the clock care, more evening care, more care during those times of day that are very difficult for you. Sometimes your providers and doctors and so forth, they might call this early, middle, and late stage, but those terms are pretty synonymous. All right, so Alzheimer's affects people in different ways. So while we're going to give you lots of information today about individuals living with the disease and those that are caring for them, remember that everyone is unique. Everyone has a preference about how they'd like to be cared for or what they like. And again, we've talked about this in the past where we say, what did this person like in the past? Perhaps they'll continue to like those things in the future, but maybe not really. Maybe things change on a day-to-day basis. So again, all of these ideas that we're going to give you will help folks certainly, but just remember, people experience the disease in a different way. And so oftentimes we have to try lots of strategies. Care needs change and increase as the disease gets worse. So eventually a person will need 24-hour care. And so today we'll recognize some of those facilities and opportunities for care. So know when and where to get help. It can be challenging to care for someone living with dementia, but you don't have to do it alone. We know that there are lots of resources out there. Those of you living in Lake County, maybe you know of the PACE program, P-A-C-E. Maybe you know of CoAction, which used to be, I think it was Community Action on Aging. Now they've abbreviated their title to CoAction. They actually have a person that's assigned in their office to be working with families to support them if they are caring for somebody who has Alzheimer's and dementia. So make sure that you know about the resources in the community, because it can be the difference between you really struggling and getting some support. Okay, so be sure always to check your insurance coverage or the coverage of the person that is suffering from the disease before you hire anyone for help or before you decide on care, because some of these things can be very important to you financially if they're not covered. So let's look at different types of respite care. So just to give you a little definition, respite care gives caregivers a short break. And it can be delivered to you in many ways. It can be through friends. It can be through a social service agency. It might be just that somebody's delivering something to your home or cleaning your home for you, just to take some of the burden off of you. And it's not necessarily directly related to your caregiving. It might be that they can help you out in different areas of the home instead of you doing all of it yourself. So it's a short break where someone else cares for the person living with dementia in a safe environment, or getting some rest. And making sure that you can deliver the best care possible. You're only as good as you are well yourself. So let's look at different types of respite care. The informal help is recognized on this screen, and it includes accepting an offer of help from lots of different people. Maybe it would be a friend or a family. And I always tell folks, um, when you ask for help from somebody and they say, listen, my schedule this week is crazy, I don't think I can help, maybe leave it open to say, oh, can I call on you in the future? And they may say, sure, today is just bad, or this week is just bad. So kind of leave that door open for help and support. So family members, whether they live close or far away, friends, and other trusted individuals. Like I said, it might be somebody that can help you to make appointments. It can be somebody that might help you with your bill paying and your finances. Or a person can just sit with the individual who's suffering from the disease while you go take a walk, read a book, take a bath, take a shower, whatever those things could be. So these are forms of informal care. Home care involves paid professionals who help with daily living tasks. So they can be companion services where they might be there, but you're still kind of supervising, okay? Or they are working closely with this individual and you're kind of in the general area. Maybe they're doing recreational activities with them, taking a walk, whatever the case may be, or maybe visiting with you. Personal care services are those things where folks are actually getting their needs taken care of through a bath or a shower, maybe helping get dressed in the morning, maybe using the toilet, eating, exercising, things like that. I know recently with my mother-in-law, while she didn't have Alzheimer's, she was at end of life. She was in hospice. And so really early in the morning, it was hard for us to drive from our house to Chicago where she lived. And so we had somebody come in super early in the morning, just so whoever stayed with her at night, which was a brother of ours, he would leave and then somebody would come in and just get her showered, sitting at the kitchen table and giving her food until we were sure that my husband then could get to her. So maybe that's something that can be helpful to you. And then different household services, shopping, cleaning, making meals for you, or finding a service like Meals on Wheels or something in the area that can help you do other chores that are just overwhelming to you because you're caring for this individual. Then we have adult care services, and they are offered to you in a supervised place outside of the home where the person living with dementia can be social with others, maybe do activities with others, such as we know that music is really a wonderful opportunity for folks with dementia, or maybe they have an exercise program. And this is a great option for a caregiver during the course of the day where you can kind of drop off, know that they're in supervised care in a place for the day or for a certain amount of hours, and then you can go do the things you want to do. In fact, when I was teaching this program at the Griffith Library, there was a woman that came to our program, this same program, all 5 sessions, and she said, right before this session, I dropped my husband off at adult daycare center so that he can do what he wants to do and enjoys that. And I don't feel guilty about trying to come here and learn more about the disease and how I can be a better caregiver or how I can care for myself better. So again, use those opportunities the best you can. So the benefits include giving you time to rest. Maybe you want to run some errand or finish some jobs that you have started at home. Maybe you're packing some things up. Maybe you're painting, cleaning up, whatever the case may be. These centers are typically open 7 to 10 hours. So some have weekend evening hours. And so perhaps around the clock, you can say, you know what, I'd love to go back to work part-time, but I don't know how I'm going to do it. Well, perhaps this would fit into your schedule where you go to work for 2 to 3 hours or something while this individual is being cared for and looked after while you're gone. Many often provide transportation and meals, so that's another thing that perhaps you wouldn't have to worry about if you enrolled in a program like this. Again, I know that PACE has something like this, so look at the resources in the community. So then we have home health care, which is another way of looking at things. When I talked to you recently about folks that might come to the home to give you home care, oftentimes that is a person, again, that's feeding, showering, dressing, maybe just supervising, being a companion to this individual. Home healthcare is a different area altogether because it includes the idea of having a licensed healthcare professional maybe visiting your home. So maybe they're a nurse or a physical therapist. Maybe they're doing a little bit of wound care. I know, again, with my mother-in-law, she continually fell. And because she was older, her skin was bruised for such a long period of time that they would come in and change those bandages on a daily basis. Maybe this individual needs some shots or injections. This would be something that they could handle too. And also physical, occupational, and speech therapy can be done in this home health care setting. And I have to tell you, the individual who is in their home and being given care and love and attention, it can be very unsettling for them to go elsewhere. So being in their home environment can be lovely. Okay, we are going to move on to long-term and residential care. Okay, so someday the person living with Alzheimer's that you know and love may require more care than you can provide. And earlier on in the presentation, I talked about this idea of moving through these stages. And oftentimes your healthcare provider will have a conversation with you where you're saying to yourself, I just can't do this anymore. It's me all alone. During the middle of the night, I'm not getting any sleep anymore. I really think we need to move towards thinking about 24-hour supervision or more intensive care for this individual. So let's look at the terminology behind some of these opportunities for a different level of care. So as I click on independent living here, independent living centers, they may be a good option for people who still mostly care for themselves. These centers usually have limited supervision. Many offer social activities, transportation, food, other services. In fact, there are opportunities for both of you to live in homes, outside of senior living where you can actually move to different types of care within a facility simply because of what you might need at a different time in your life. Then we have assisted living. The difference here is they are a good option for a person who can no longer live at home by themselves, okay? They need more nursing home care. And so these centers provide you with a mixture of different things: housing options, meal options, supportive services. So maybe they're providing medical care, maybe they're providing recreation and exercise and all of those things, but healthcare is involved here too. So look at the notes or the bullet points at the bottom of this slide. The federal government does not regulate assisted living homes, and assisted living can mean different things in different states. So that's why it's real important for you to connect with whoever it is that you're going to for care, really getting a good idea about what they are going to provide. And secondly, it's important for you often to reach out to social service agencies in the area and say, like, what do you know about these programs? And And you also need to make sure that whatever they're offering you is perhaps covered by your insurance, whatever method that is. So not all assisted living providers have programs for people living with dementia. So you often have to ask, because you may say, oh, this is exactly what I'm looking for. It's assisted living. It's beautiful. I've heard my neighbors say it's wonderful. So you go there and they say to you, listen, we're not taking any patients with dementia right now. And then finally, this is skilled nursing homes. So they provide 24-hour a day long-term care and medical help. And again, they offer an abundance of support to you. So again, they're thinking about the food and nutrition of the individual who is in the center. They have a planning with you on a care plan. They offer activities, spiritual and religious services, medical care, as well as all the activities of daily living. So oftentimes they're working with folks to make sure that everything that they need to do throughout the course of the day, that they are being cared for it. Again, showering, bathing, clothing, eating, all of those things. But the skilled nursing homes are really working very closely with the individual with dementia. So let's look at end-of-life care. And you know what, we really encourage you to have conversations, no matter if an individual has dementia or not. As people age, we should be having these conversations. We should be thinking about power of attorney for your financial as well as your medical. You should be thinking about a living will. You should be thinking about talking to your children about, boy, this is what I'd like my end of life to look like. This is what I'd like my funeral planning to look like. I mean, it's inevitable that we're all heading there. And so it is an important thing for us to remove the stigma of having these conversations and really, when you can, voice what it is that you want for yourself. Now, can you get everything that you want all the time? No, but certainly the person that's caring for you knows what you want and will do their best to satisfy those needs with the resources they have. So really important to you, for all of us, to think about end-of-life care well before end of life. Okay, so as we move through this slide, you can, and on all the slides following this one, this is palliative care. First, we'll talk about what it is, what the goal of the care is, how does it work, and the service availability. Just keep in mind as we go through these slides that you also need to know what insurance you have, what will be covered, can they provide services for your situation? And so these are things to think about as we move through all these slides. And as I said to you on the front end of this presentation, everyone is unique. Everyone has different preferences. So it's important for you to know that you feel comfortable in the situation, as well as the best that can be possibly available to that person who has Alzheimer's or dementia. So palliative care is specialized medical care that focuses on providing relief from pain and can help a person cope with the side effects of medical treatment. It also provides comfort and support to the people living with a serious illness. So when we think about the goal here, it is to relieve pain, to control symptoms, to prevent side effects and complications, and maintain the best quality of life for that individual that you can with the circumstance you have at hand. So just know that this is the goal of palliative care. How does it work? A team, maybe doctors, nurses, specialists, they work together to provide an extra layer of help to you. They focus on the needs of that person that needs care, and it does not focus on the disease or the illness as much as, again, providing the best care they can through end of life. They can be at any stage of serious illness. However, it's usually near end of life that this is something that you will look to. And people can receive palliative care with other treatments as well. So it isn't just Alzheimer's. Okay. We do want you to know that The availability of care does not depend on whether a person's condition can be cured or not. Medicaid, Medicare, and other private insurances do cover this cost. Veterans Administration offers coverage as well, but you always have to know that your plans may vary and that it's really up to you to check into these things before you just say, oh, I have this insurance, it must cover. Okay. Okay, this is hospice care. So again, what is it? It's a special kind of care that focuses on your quality of life of those that are experiencing any kind of advanced terminal illness and support to their caregivers. It treats the person and the symptoms of the disease rather than treating the disease itself. So I used the example of my mother-in-law who just passed away a couple of weeks ago. She was in hospice care. She had cancer of the stomach and esophagus. So no longer was that being treated, but her pain was being treated. Her wounds were being treated. She was being given care for comfort and quality of life as she continued to live. Okay, the goal here, again, the goal of hospice is to provide compassionate care to people in the last stage of their terminal or incurable illness. We want them to be fully comfortable and we want them to have a quality of life at the end of life. So how does this work? Again, a team, doctors, nurses, home health care providers, counselors, clergy, volunteers, all kinds of folks come in to help to provide care. Most people receive hospice at home. However, you can receive it at a nursing facility or a hospital if that is the agreement that you've worked out. So some examples that I can provide here are that medical care for symptoms and pain is administered. Oftentimes, a nurse will come in on a regular basis and help you manage what it is that needs to be managed for this individual. Oftentimes, even an emotional grief counselor or a spiritual counselor can come into the home too and talk to you and your loved one about what's going on. Again, hospice has like 24/7 help and support, but not all do. Some of them, it's hard to contact them on the weekend. Maybe you're going to get an answering machine and somebody will call you back at a certain amount of time, whereas you might call during the week and you get somebody right away. So again, that is something to talk to the provider about and say, okay, give me the number that I call for the weekend. Give me the number that I call during the workday. Who are the people coming into my home? Ask these kind of questions. They do deliver medical supplies and equipment like beds and oxygen and wound care and all of those things to you at your request. And respite care gives you a break as a care provider too. Okay, and then service availability. Typically, it provides care during the last 6 months of a person's life, but this is not always the case. I just talked to you about my mother-in-law, and I think she was in home hospice for over 9 months. And I've talked to others who that varies as well. So the 6 months is not a hard and fast rule. Think about the coverage here. So if you're on Medicare, Medicaid, or you have private insurances, this has to be ordered by a doctor. So talk to your doctor about hospice care as well. And also check with your insurance to make sure that you know where you are with payment or what your program provides. Also know that if you are a veteran, Veterans Administration offers coverage as well. Plans vary, so check with them, okay? Now be sure to check with coverage and your own doctor because you will need an order from a doctor. So now it's time to turn to end of life conversations. And as I said to you a few minutes ago, start these conversations early. When we lost my mother-in-law a couple weeks ago, it really brings forward in you I'm sick, I just turned 63. It's in your mind, you're saying, you know what? I need to start these conversations now because you realize how difficult the conversations were at end of life. So thinking about preparing legal and financial documents, and these are called advance directories. So think about the living will, power of attorney for financial as well as medical, and other things that you might have to gather from the individual who is suffering from the disease, because perhaps there's some money that you're going to need to pay, and where's that coming from? So you can talk about finances with this individual early. And this is a touchy subject to start saying, well, how much money do we have here? People don't like to talk about those things, but it is important for you to say, listen, it's inevitable that that we need to think about and talk about this. And as I've said in many of the sessions I've had before, talking about this early means that the person will have more of their faculties to have a conversation with you. If you wait too long because you're uncomfortable and embarrassed and the whole works, you might then be having a conversation with somebody who can't help you to decide where you want to go, what you want to do, and how your finances look to support this. Think about the person's quality of life when you make medical decisions. Think about your quality of life too, because if you are struggling health-wise, and I've heard this from lots of folks, if you're struggling health-wise, you may have to say, you know what, I need to have my person go to daycare services because I need a break during the day. And I'm going to talk around with all my friends and social service agencies to see where is the best place for me to do this, where I'll feel the best about it. And then you can have a little bit of respite yourself during the course of the day. Think about, like I said, reaching out to friends to say, if you can't help this week, do you think you can help next week? That kind of thing. And reaching out to family as well. Okay. So again, think about that quality of life as you make decisions with them as well. So let's hear from an expert as she talks a little bit about making these plans.
Having discussions about end-of-life care can be emotional and difficult for everyone involved. Yet there are benefits to having these open and honest conversations, especially in the early stage of the disease. One of the most important benefits is that the person living with dementia has the ability to make decisions about how they want to be cared for at end of life. It can also provide families with peace of mind, knowing that they are carrying out that individual's wishes. It's important to remember that these conversations may need to occur over time. It may require a conversation over multiple days, or multiple weeks, or multiple months, and that's okay. I think what's most important to remember is that these conversations occur as early as possible and with the person with dementia whenever possible.
So let me give you an example of something that she just talked about here. So let's say that you have 3 or 4 family members and you care about your mother. Let's say it's your mother who is getting older and perhaps showing signs of dementia. So you invite them all over on a Friday night with their little kids, and you said, come on over, we'll have pizza together, we can all eat together, and then let's sit down with mom and have a discussion about all of this, okay? Mom might not be ready to have a discussion about all of this with all the kids running around and the pizza and all the chatter. That's maybe not the best time to do this. So let's say it fails. Let's say mom says, I'm overwhelmed. I'm not ready for this. You caught me off guard, blah, 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 blah. Okay. So you then say, oh, well, I guess it doesn't work and she doesn't want to talk about it. And then you shelve it. That's not the way to do this. As this individual said, it may take several months. There's a program that I do, and there's a woman who speaks on the program, and she said, boy, I couldn't get a word out of my mother about what she needed or cared about. And her dear friend down the block passed away. And after she passed away and they were sitting in the kitchen together, she took another opportunity to say, you know, so-and-so passed away, and I hope they made some plans. I hope they talked about this early on so that she had a funeral that she helped plan, or that they were financially okay because they had talked about this ahead of time. And all of a sudden, this woman opens up and says, I think it's time that we talk. Right? So when you see a dear friend about your same age that passes away, you start saying, oh, maybe I need to do this. All right. Okay, so we'll think about medical decisions. When we think about the goals of care and medical treatment, you may choose a person's comfort and quality of life instead of living a longer life. Do you see what I mean? So you might say, oh yeah, we want to go with the chemo for as long as we possibly can when this person is really sick and can't do anything. And it's really just prolonging life, not necessarily quality of life. So we want to talk to you about some medical decisions that you might have to consider. So as I click on the box here, you'll see the do not resuscitate, which is a DNR order. This is, again, important for you to talk about early, but you may have to revisit it. Because someone who is at a certain stage of their life, they'll say, no, I don't want a DNR order. But then they get weaker and weaker and sicker, and they see that their quality of life is poor. They all of a sudden say, you know, I think we need to revisit that. I don't want to prolong this. So a DNR is a legal order that a doctor writes. It stops medical professionals from using CPR or other life-saving procedures to help the person, their heart to stop beating, okay? Now, this doesn't mean they still don't get their injection for their chemotherapy or their dialysis or whatever they need. They just don't want to provide a life-saving procedure like CPR. And then life-sustaining treatments. Here are some examples of medical care of late-stage Alzheimer's disease where you say that I don't even want these things any longer. So things like respirators, feeding tubes, IV hydration, antibiotics, CPR, or surgery. So these things you've taken off the shelf as well. You just say, I do not want life-sustaining treatments anymore. So hopefully you see the difference there. The DNR order is simply because of we do not want to provide CPR if the person stops breathing. These other life-sustaining treatments are things that we take away as well. Okay. And so it's worth the conversation. Let's hear from an expert.
Unfortunately, this disease requires caregivers to make a lot of difficult decisions. It's important to really go easy on yourself. Take the time to think through your options, make those decisions, and don't forget to rely on others for support.
And this is where, you know, a lot of folks that are in these classes, sometimes I'll have 12 or 15 folks in a class and their loved one is in a different stage of Alzheimer's. So somebody might be really far along in Alzheimer's and have gotten care at different stages. And someone else might be sitting across the table from them saying, boy, I'm lost. And so sometimes even talking to other people in your community that you trust, even in your faith-based organizations, because you know the numbers when it comes to those that are affected by dementia and how many women are affected by dementia and Alzheimer's. So really important for you to have conversations with those you trust, certainly doctors and healthcare providers, but even your family members and faith-based organizations can be helpful too. Okay, so this area is moving care settings. So I want you to know that moving care settings can involve several different things. It might be that you're moving from your home to a care facility that's going to provide you more 24/7 care. It might be you moving from your home just to an emergency room because something's happening and it needs to be cared for immediately. Or it might be that you are already in a care setting that isn't providing enough care and you need to go a step up to maybe some assisted living, or maybe you need some real nursing care as you move through the disease. So plan ahead. Make sure you know how the person's care will change as they move. So maybe you're kind of settled in. All of a sudden you say, okay, I need a little bit of respite care for myself during the day. So I'm going to try an adult day service for me, right? So you're loving this and it's fine, but you do realize that this person is probably going to need some more care on the horizon. So just don't settle right there. Say, what's my next step when I need a next step? And perhaps have this conversation, okay? Instead of saying, this is really working well, I love it, it may change. And it's important for you to have that conversation with family members, with friends, with doctors, and certainly with the person who's suffering from the disease. Communicate with the person living with dementia. As I said, if you have these conversations beforehand, it'll certainly help to sit better with you if you say, now we're going to make a change. I'm with you all the way. We're going to go to a new facility. And oftentimes the person may get the concept of the movement or may not, but still this opportunity for you to have some conversations ahead of time and to get yourself prepared for the move can make it easier on everyone. Also communicate with a new provider. So if you're moving from care to care, you need to communicate with both providers and make sure they are communicating with one another to share your preferences, your care plans, your medical records, and those advanced care planning forms that we have talked about so that people know, I've signed a DNR. We are not signing a DNR, whatever the case may be. Those are conversations that you want to make sure everybody is on board with. And usually they will come in and speak to you, but sometimes you have to be on the forefront of this as well. Make sure you have open communication. Keep communication between providers across all settings and within organizations and clinical practices all on board. Okay, so if a nurse is coming into your home and providing some kind of care, you're communicating too. What's the next step? What happens on the weekend if something happens like this and I can't get a hold of you? Should I go to the emergency room? Should I not go to the emergency room? What can I do? So be asking these questions on the forefront. Review the person's care preferences and goals. And as I've said before, there are things that people like and have liked their whole life. Maybe they like jazz music and they like to have it played in the background very low as they sit and maybe look out the window. Those are things to share with others. So if this person is feeling anxious and itchy and they don't like the temperature in the room and there's loud noises happening all around, maybe that's the problem, not necessarily some other layer to their health care. Okay, so advocate for the person living with dementia. You are their loved one. You, in most cases, know what they need. You want their quality of life to be good. You don't want to feel guilty about leaving and saying, I'm not sure what's going on there. You want to be in tune with what's going on, but you also want to be asking questions about your concerns on behalf of the individual that you care and love for. So don't be afraid to ask. I think a lot of people are afraid to ask or challenge a little bit to say, gee, I'm not happy with this. Are there other options? Just to ask, can you give me all the options? Not just what you think I need, just, okay, I heard that. What about some other options as well? So we do want to share with you the Alzheimer's Association resources. We do this every time that I'm here, but some of you that are on the call right now, maybe you've been using some local resources. Remember on the front of the call, I asked you to pop those in the chat box if you want to share them with us, and Annie is checking that out for us, even those of you in the room. I did mention the PACE program out of Franciscan. If you haven't heard about it, I've only heard good things about it. So, and it's out of Dyer. So if that's something you're interested in, to give them a call. They have support services and support groups for those of you that are caring for individuals, but they also have services for those that have Alzheimer's and dementia that you might be surprised how beneficial it is to you. In fact, the woman who said that she was coming to my programs during the course of her husband being at some adult care services, they were being offered by PACE, okay? The other thing to think about is co-action in Lake County, because Jen, I believe it's Jenn, she has been put in the position in co-action to really service families that are affected by Alzheimer's and dementia. The Alzheimer's Association advocated for that in every state, that we have our community aging services folks really working with individuals and families that need this support simply because it's so prevalent. Lake County, again, has the highest incidence of Alzheimer's and dementia than any other county in the state of Indiana. So we have a person located here, and that is co-action. You can go to their website, or you can certainly give them a call. I'm here today to talk about the resources that Alzheimer's Association has, that 24/7 hotline. Lots of people say to me, you know, I finally called that hotline, and it was the first time I could breathe a little bit easier because I just was lost. I didn't know what to do. I don't know if I was even facing this myself properly. So the helpline is really great. They have master's level clinicians answering those phones and trying to get you to the place you need to be in order to support you most. Also, there are local resources, so you can certainly click on find a chapter or find local resources. You'll put your zip code in, and they will the web page will populate with resources in your area. Some folks are a little shy of the computer, so just call the 800 number. It's listed here, and just say, I need services in my zip code. I live in the Gary area. Tell me what is surrounding me that I need, okay? They do have online programs, lots of ways for you to be connected. They even have educational programs like the one I'm doing with you today, where you can attend it online, you can attend it in person, or you can certainly watch a recorded version of it, kind of like what they're doing here at Cure, so that all of these have been recorded and you can revisit them if you need them. So that concludes the session for today. And this is the end of this series, the Caregiver series, but I'm sure you'll see me again as we partner with Cure in the future. So thanks everybody for joining us today.